Hi guys, welcome back. You're watching my video series on antibiotics, and this video will be about tetracyclines. So tetracyclines are used to treat acne. And the way you can remember this is that when girls start middle school or high school, their hormones are cycling a lot, right? So this girl in middle school, her acne is just terrible, and that's because her hormones are cycling to the extreme, right? She has a tetracycle, like not just a normal cycle, but a really terrible tetracycle. And every time the cycle swings a certain way, she gets really bad acne. So tetracyclines are used to treat acne. Two examples of tetracyclines. One is doxycycline, and the other one is minocycline. And the easiest way to remember this is that they both end in cycline. Cycline here, and there's a long list of tetracyclines. Really the only one I've ever given in practice is doxycycline. But you can remember that they end in cycline. So tetracyclines are used to treat acne, so let's go back to our teenage girl mnemonic. So side effects of tetracyclines include photosensitivity or phototoxicity. And you can remember this because this girl with terrible acne does not want to have her photo taken. So she's going to be photosensitive. You're supposed to take this on an empty stomach. And most antibiotics you take with food. So it's easier just to memorize the ones that you take without food. So you take tetracyclines on an empty stomach, so I imagine that would be easy for a teenage girl. Teenagers usually sleep late. They don't always eat breakfast. So you need to take that on an empty stomach. It's not for children or pregnant people, right? So it's contraindicated in children, contraindicated in pregnancy. So you can imagine that this teenage girl with terrible acne is not at a good place in her life to get pregnant or have children. Also, if her acne's too terrible, she probably won't have the opportunity to get pregnant. So whatever memory trick works best for you that way. Tetracyclines work. Their action is to decrease the replication and growth of bacteria. And so you can remember this because if you remember, it treats acne. That's what it's doing, right? It's preventing the spread of your breakouts. So acne, part of acne is bacteria on your face. And if you notice when you have a zit, you tend to break out in a certain area. And that's because that bacteria is spreading very directly next to itself. So it's going to decrease the growth and replication of bacteria. So if you remember acne, you can remember how acne spreads as you break out, so it's going to decrease that. So that's tetracyclines. Let me know if you have any questions, comments, or suggestions for more videos. Thank you.